All right, Brady Kielgas, awesome. We're so excited to have you here today to talk about this, to hopefully get our feet and ankles all ready for March into May so that we can get to step. And so I'm going to hand it over to you and I will manage the chat and let you know when there are questions.
Sounds great. Awesome. Excited to be here. Feet and ankles are kind of my secret passion. I did a 4-month rotation at the Cincinnati VA hospital working with high-risk diabetic foot patients, those at risk for amputation if they don't keep their feet healthy. And I know kind of the really, really, difficult parts of that. So glad to be able to talk to you all today and hopefully give you some good advice on keeping your feet and ankles healthy. All right, so let's jump right in. Big objectives for this sort of class presentation. We're going to kind of dive into the anatomy of the foot and the ankle because I think it's really important to kind of know where we can have some breakdown with that. Then understand a couple of the more common foot and ankle injuries, especially if you're starting to get into being more active, or you're a little bit more sedentary with your job if you're doing a lot of sitting throughout the day. And then kind of really learning when to go and ask for help from a physical therapist or a podiatrist, and how to go about those options. So we'll go right into the anatomy of it. So the ankle, it's really made up of 3 bones, and you can kind of feel it on yourself if you walk your hands all the way down to those side ankle bones. Those make up those are your tibia and your fibula. And then underneath that is your talus. The bony anatomy of your ankle really provides just a lot of passive stability. And when I talk to patients about kind of passive and dynamic stability, really it's just, I tell them to picture like a Jenga tower. The gravity is holding things in place, but if you push it or if you move it, things are going to kind of fall apart. That's the stability you have with static structures. So like your bones and your ligaments. Your muscles are really what provides stability when you're moving. So if you think of like a cell phone tower with a lot of those guy wires, they provide a lot of structure and stability when things are swaying back and forth with the wind. So your ankle, your ligamental anatomy, so the ligaments around it, are a common area that we can kind of have issues, especially with ankle sprains, falls, trips. Those provide a lot of passive structure to the ankle, so not when we're moving, but just static standing. Then our muscular anatomy, we have about over 10 muscles that kind of come from our lower leg and move down into our foot and provide a lot of control when we're walking, when we're running, when we're standing, and provide a lot of that extra stability and motion. Any questions on that so far? Cool.
I'm not seeing anything in the chat quite yet.
Perfect. And we'll move on to the foot. I love the foot. It's super confusing and complex, but once you kind of understand it, it's great. You have about 26 bones in your feet. All of them kind of articulate with each other, and we have ligaments that hold them all together, and then muscles inside of the foot that provide a lot of support. It's actually a similar structure to your hand, and I've seen in videos and seen people that have hand amputations that are actually able to do the same type of gripping. They play guitar with their feet because they've trained those muscles to be able to actually function like a hand. So it's really, really cool when you can start training up those muscles in the feet to become more functional, especially with returning to running or starting walking programs. Getting your foot strong too can help prevent a lot of the issues that you can have with like plantar fasciitis, ankle tendinopathy, like any sort of Achilles injuries. Being strong there as well as kind of through your whole body can help prevent a lot of those injuries when you start your walking programs or your running programs too, because they help distribute a lot of that force whenever you impact your foot. Any questions there? I'm gonna do a little pause. Cool. All right, we'll move right into kind of the common injuries and pathologies that I see as a physical therapist and stuff that we generally treat, and go from there. So we'll stop after each sort of issue, and open it up to questions as well. So feel free to text them in the group chat, and Sadie will kind of let me know. Okay, first one. This is a major one that we see a lot, is plantar fasciitis. So the definition of it is basically any sort of inflammation and pain along that attachment site of the plantar fascia, which is just a big, long connective tissue, similar to like a ligament that connects from your, I'll use my mouse here, kind of the forefoot here and all the way along to the heel bone there. So a lot of people can feel kind of that sharp, stabbing, burning type pain in here, usually if you're on your feet for a long period of time, and you don't have a lot of good arch support, you have really tight calves, you're, standing a lot for your job, or you're changing your footwear and doing a lot of walking. And generally my patients, when they have plantar fasciitis, they'll say that the first step in the morning is kind of the worst. Then it'll kind of loosen up a little bit, but if they're standing or walking for a longer period of time, it kind of comes back. And generally, it's from my perspective, from what I've seen, it's a lot of really, really tight calf musculature and poor footwear that kind of causes this. Any questions on that so far? Okay, we can move into the treatment of it a little bit.
Oh, excellent. That was my question, was the treatment.
Yep, right here. So kind of stuff that you can look for yourself before going to kind of a PT, going to a podiatrist. Really taking a good look at your shoes and the shoes you wear day to day. This is more for runners and stuff, but having two different pairs of shoes that you kind of alternate with day to day can be really helpful. Like kind of the same style of shoe, but two different pairs, because what can happen if you're on your feet for a whole day, 8-10 hours, or running frequently, is the midsole of your shoe, kind of this area right through here, will actually depress and not provide as much support. And you actually have to give those shoes a day rest for it to kind of bounce back and be more supportive. Really looking at shoes with good arch support, especially kind of on the inside of your foot, because that's where if your muscles aren't strong enough and your calf's a little bit too tight and your arch starts collapsing, you can get a little bit more pain through that plantar fascia. I like looking at the heel counter, which is kind of the back of the shoe here. If you have a really, really narrow or increased angle in your heel counter, that can push kind of on your Achilles and cause some friction, some irritation, and some tightness there that eventually can kind of contribute to your plantar fascia pain too. And yeah, talking about the midsole like we already did. So things you can do kind of throughout the day to work on your calf mobility or your calf, muscle length, as well as mobility in your feet, are kind of calf stretching and soleus stretching. So those are two big muscles that kind of combine down into your Achilles tendon. One of them works better if your knee is straight, and the other one works better if your knee is bent. So you want to try to do those stretches throughout the day. I tell my patients usually around 30, 40-second holds 3 to 4 times. And then you can stretch your big toe. That also pulls on your plantar fascia and kind of gives it a little bit of input to try to calm down as well. As far as strengthening, these are where we really focus on, your intrinsic foot muscles. So all those ones I showed in the picture a while ago. And then also your calf strength too. So toe crunches are kind of where I start with. Because when you kind of pull your toes down, you can feel those muscles in the bottom of your feet working. And that's kind of where I begin, right? You want to try to isolate that motion, isolate those muscles, and then we move on to arch lifts. I think I saw a question about arch lifts in the chat here. Arch lifts are basically like you're trying to make this little bone in your forefoot, the front of your foot, and your heel close together. So it's almost like you're trying to lift the arch up when it's on the ground. I tell my patients, it kind of feels like your foot's about to cramp up, but it doesn't. And those are great to start with too, building up that strength in your foot and providing a little bit more stability to that plantar fascia. Heel raises as well are great because we want to try to strengthen and lengthen the calf so that it's not pulling so much on the heel bone and in turn pulling on the plantar fascia. As well as, ankle range of motion so that we can try to prevent any sort of issues coming back. Ankle strengthening, progressions of exercises and loading. If you're starting on a walking program and you're getting kind of this plantar fascia pain, if you're walking for 20 minutes and it's starting to bother you around 20 minutes, that's where you stop. You kind of do what you can tolerate and gradually progress it so that we're not doing anything too quickly and progressing too quickly that we start causing issues in the foot. Other things that I like to give for patients to just kind of reduce some of that pain and get a little bit of relief is a frozen water bottle massage. You just throw like a Poland Springs bottle in the fridge and you roll over it, or in the freezer and you roll over it on your foot. Same with a golf ball, trying to really target that plantar fascia. Any questions? I think I saw some pop up, Sadie.
Yeah, we do have a couple of questions.
Sure,
So
shoot.
I can hear that I'm echoing, sorry. All right, so somebody said, I fractured my big toe about a year and a half ago and wore a boot for a while, but now I have fairly constant pain and cannot fully bend toe. Advice for footwear, and is there anything that can be done if the fracture did not heal correctly?
So a fracture that long ago, and depending on how long you were actually immobilized in the boot, there can be some difficulty moving that toe for sure. I would suggest actually going to see a PT about it. They can help with trying to get that motion back in your toe and managing that pain a little bit better. As far as shoes go, it's difficult to say. You'd probably, if there's still any sort of swelling or difficulty, putting weight through that toe, you'll probably want a little bit more of a wider toe box so you can accommodate some of that space. But really, it's hard to say without knowing kind of the fracture and what was done surgically to kind of correct it. So I'd recommend going to like a PT to see if there's anything that they can do.
And the next question is there a brand of shoes good for plantar fasciitis?
There's a lot. You can kind of look up a lot of lists, but from the top of my head, there's Hoka's I've heard are really good. Asics brand. They have really good walking shoes. But those are sometimes pretty pricey. I've heard some good things about Skechers, but I've heard the midsoles on those kind of degrade more quickly over time. So you kind of have to replace them a little bit more frequently.
And then we had two questions in a row that are fairly similar about stretching. So is it best to stretch before or after a long walk, or to do both?
It's better to get warmed up first. They've actually shown that cold stretching doesn't really do too much. So if you were to kind of stretch 5 minutes, 10 minutes into a walk and then continue, that's kind of what I recommend my patients do. My dad is one of the older generation that always stretches before he goes for walks or runs, and I always have to kind of fight him on that.
And the next one is, what do you suggest for people with flat feet and not much arch?
Definitely looking at shoes with good arch support. So like I was saying, the Hoka's and Asics usually are pretty good. They have different styles that may provide a little bit more support than other styles that they have. So any sort of running or shoe store usually has a good idea of what kind of options they can give you. But as well as kind of that arch strengthening, the intrinsic foot muscle strengthening as well, can be really, really helpful.
All right, and the last one we have is, does yoga help or can it hurt too much?
Hard to say. I mean, I love yoga. I'm a huge fan of when patients, are telling me they're doing yoga, because that can be very, very helpful and a good exercise outlet as well. It depends on what the issue is that's causing you pain. If it's something like like plantar fascia, but it's caused because your foot muscles are not strong enough and yoga is not directly targeting those muscles, then you might not get much relief from it, because we're not really attacking the main cause or the primary impairment. So I love yoga. It's awesome, but it would have to be in conjunction with specific strengthening or stretching exercises that kind of combat the main issue.
Thank you. I think we're good to move on.
Awesome, cool. The next one I want to talk about is bunions. This was something that as a kid I had no idea what they were. I thought they were onion-shaped growths on feet. So that was eye-opening when I went through school. But really, a bunion is kind of a deformity of your first toe, so your big toe, that develops right at the base. Usually becomes pretty inflamed, painful, and there's kind of a range of how severe they can be. The big thing that I found in research is that you do have a genetic predisposition for them. They found some mild evidence that shoes can cause and irritate the symptoms, but that's with really, really narrow shoes. You're thinking like your high heels with the pointed toe, putting your toes all squished together. But really the symptoms of kind of bunions are, that sharp burning, swelling, inflamed pain right along that first joint there. And it can lead to this kind of deformity. This is probably more of a severe case. You can have more mild, that the angle would be a little less, but still kind of cause you pain. But it can really lead to a lot of other issues, gait problems, issues with putting weight through that foot, and difficulty kind of returning to regular walking and activity. So it can be definitely detrimental to kind of your normal function in life. Moving on to kind of treatment, it's difficult to say, if there's a way to prevent bunions, because they are pretty much genetic, but from what we know in treatment PT wise, having a good team on your side, a PT and a podiatrist looking at trying to either prevent bunions or maintain what you already have so that it doesn't become so bad that you'd end up needing surgery to kind of reset the bunion. Looking at shoes, that's one of the first things that I look at with patients. Shoes with big, wide toe boxes. So the toe box is kind of right through here. You want to give enough space here so that you actually have enough motion in those toes so that they can kind of spread out and not be forced down and have any sort of rubbing on the actual first toe to cause that inflammation. These are a couple brands that I've found that are really, really good. I think this is an Ultra brand shoe on the right here. But they're great for walking. They have really nice wide toe boxes, and they're pretty good. You can try, orthotics and splints. These are some over-the-counter ones. The big things with these is it's really tough to sometimes fit those in your shoe. So you kind of have to play around with them. There's been, some mild evidence that shows that these can be helpful, but if my patient comes in, they say that they're awesome and they help a lot, then I'm all for it. They also have, they have toe separators too. It's kind of like your almost like your pedicure toe separators, that you can get separate ones for your big toe and your second toe there. Similar type exercises for strengthening those intrinsic foot muscles. The big ones that I will do with patients that have bunions are actually toe spreads, where you're actually trying to open up those toes as wide as you can and then come back. Okay, because we're trying to train that muscle on the side of your foot to help pull your big toe out and into better alignment. But with all of these treatments, having a PT on your side can be really helpful because we have a ton of different ways to kind of target things and reduce pain. But really, a good podiatrist as well is helpful at managing symptoms, providing relief with other sort of options, injections, strengthening prior to surgery if that's the route that they plan to go. Any questions on that so far?
Nothing in the chat box.
Cool. All right, moving on. Ankle sprains, another super common one that we see. This is a big, like we were talking about before, the ligaments help provide a lot of passive stability to the ankle. And when they're stretched out with a sprain, that can make the whole function of the ankle a little less stable. We have medial sprains, but we also have lateral sprains too. If you look at this little picture over here, right, the more common one is an eversion sprain. So that's the one where you kind of step off the edge and you roll your ankle in. That will stretch out those ligaments on the outside of your ankle. The least common one is probably more this inversion sprain where you roll your ankle inwards. That's because these ligaments on the inside of your ankle are actually a lot more strong, a lot more tight, so they don't get stretched that easily. But they can ankle sprains can be really, really tough because when they're not addressed and you don't work on certain things, they happen a lot more frequently. I found in the research almost 75%, that's like 3 out of 4 people that have one ankle sprain are going to have another one, within their lives for sure. And that's a lot of ankle sprains and a lot of swelling, pain, and stuff that can be avoided. So really, after you have a pretty bad ankle sprain, you'll have pain, you'll have a lot of swelling, and you may even have bruising. It can be pretty tender to the touch too. Actually happens more often than basketball than any other sport too. But I mean, you can kind of tell why. So general treatment of ankle sprains. I'm sure a lot of you have probably actually gone through ankle sprains at some point in your life. And there is a little bit of a change in the way we treat them from, even 10, 15 years ago. We used to use the RICE treatment strategy, which is kind of rest, ice, elevation, and compression. What they've found now is that rest portion of it is actually not necessary. So we actually use the police treatment strategy, which is we progressively load the joint kind of to what you can tolerate pain-wise, use ice to reduce pain, and compression and elevation. So those kind of stay the same, but that rest portion has actually been shown to be detrimental at, providing improvement with your muscle strength and the actual ligament recovery. These are just kind of general numbers up on the top. A mild ankle sprain can take 2 weeks to 2 months to heal, and really, really high grade ankle sprains can cause those micro tears in the ligament and take up to a year to fully heal. So where we start treatment wise is with that police strategy, managing those symptoms initially, and then gradually working on loading the ankles, working on your calf stability, working on your intrinsic foot strength, your balance, your proprioception. What can happen when you stretch those ligaments is they're kind of receptors for you and your brain to know where your foot is in space and when it's on the ground. And when those are damaged, it's hard to tell when you're walking if you're right on the heel when you're walking through, or if you're on this side. So it can mess up with your proprioception, or where your joint is. And that in turn can lead to more ankle sprains, which makes it just harder and harder to heal. what we do as PTs is really try to normalize your walking pattern, work on that strength and mobility, and work on that, training up that proprioception and balance to help prevent further ankle sprains and further injury coming about. A couple of the exercises here, right? Initially, I like using kind of an ankle brace if you need. And if you've suffered from kind of chronic ankle sprains, it's not bad if you're very active to kind of have a brace on you when you're walking, when you're running, or doing activities that could lead to more ankle sprains. So tennis, basketball, those sort of things with lots of cutting. I really like this picture down here. This is a good one to kind of begin to work on if you have an ankle sprain that happened, today or, a few days ago. Ankle ABCs while you're elevated. So you can kind of work on reducing some of that swelling, but also getting some motion back in that ankle. I'll tell patients to go through the alphabet once capital and once lowercase too. And that can give you quite a workout in those ankles. Any questions so far for that?
Nothing yet, but while we're waiting, I want to remind everybody that there is a sign-in link in the chat box to earn points for today, so be sure to sign in.
All right. We will move on then to kind of Achilles tendonitis. So any sort of tendonitis, tendinopathy, they go based on kind of severity and how long it's been going on. So you kind of have your different grades over here. I really don't like these pictures too much because, it shows a lot of irritation in these Achilles, and, sometimes you may have, a certain type of injury, but it doesn't always equate to your symptoms. So sometimes these pictures can be kind of misleading. But really, the definition of that kind of Achilles pain is, pain or irritation at the top of the heel and kind of up your calf. It's actually very common in runners because you're putting a lot of load on the Achilles, and if you haven't properly kind of trained it up, it can cause you a lot of issues with overuse. This is more of the runners that I see that are kind of going from, regular walking maybe 2 or 3 times a week to trying to run 6 times a week at, 5 miles. When you have those big drastic jumps in activity, that's when it can really start flaring up. So I always talk with my patients about kind of gradually adding on activity. If you're regularly walking, 10, 15 minutes a day, you don't jump right into 2 hours a day. You kind of gradually add, 5, 10 minutes each week until you get to that goal of yours. But really the causes of the kind of the Achilles tendonitis is that repetitive trauma to the tendon related to that tightness or weakness like we talked about, the shoe wear, any sort of, if you're overweight, you're kind of put a lot more pressure on that Achilles to kind of push you forward. And like we're talking about changes in activity, if you jump up in your intensity of any activity, that can kind of cause it too. All right. Kind of moving on to different treatment strategies and things you can kind of look at. I kind of added a little pun up there. It's a good first step to see your PT. I look at shoes, okay? Like we talked about before with kind of that heel counter and plantar fascia pain, we want to avoid any sort of extra pressure on the Achilles tendon when we're walking. So taking a good look at your shoes and seeing if they have, a little bit of an angle on that back part that's pushing into your Achilles. That may be one of the reasons that's causing it. Improving as much range of motion in your calf and in your ankle as possible so that we can start strengthening in all these different ranges. And then, strengthening the calf, working on, eccentric control and good control through that muscle to help provide more stability and strength when you're running or when you're walking or when you get this type of pain. And then in the meantime, you can kind of use modalities like ice, heat, massage, soft tissue mobilization, manual joint mobilizations to try to reduce pain and improve range of motion as well. Once we've kind of got the pain and everything under control through these adaptations and other things, we work on the late stage improvements, which is really strengthening and kind of gradually loading through that progression of walking or progression of exercise so that the Achilles has enough time to kind of catch up with what your goal is with walking or running. And really looking at when that pain is starting to bother you functionally, if that's at work, if that's, when you're running or when you're just sitting, and trying to attack those individual type issues that are causing you pain. And not often does the Achilles tendonitis go into kind of like a surgery. Sometimes they may do like an Achilles lengthening procedure, but we can also kind of look at the post-op follow-up and care there too. Any questions for kind of Achilles tendonitis?
It looks like I skipped a question when we were talking about plantar fasciitis on what type of arch support do you recommend?
Really, you want good arch support through what they call the longitudinal portion of your foot. So let me go back to our anatomy here. So this arch right here, so this is the bottom of your foot, right? You have your longitudinal arch here that helps provide a lot more support to your plantar fascia, and then kind of the medial arch goes this way. So you want real good support through this area of your foot because when that collapses down, it actually puts a lot more pressure on your plantar fascia and can cause some of that pain. So when you're looking at buying shoes, you want good, sturdy support through here. And as far as kind of breaking in your shoes, when we deal with patients with diabetes, I recommend they kind of wear their shoes for an hour, walk around in them, and then go back to your normal shoes. Kind of gradually switch your shoes so that you don't get any blisters and you don't get, too much of a drastic change with your feet because you can start getting pain that way too. Does that answer the question?
Yes, I believe so. And there wasn't anything on Achilles. No questions there yet.
Okay. So those are kind of the four main ones that we see in the outpatient clinic. I did want to kind of touch on, concerns for diabetic and vascular foot care. I'm not sure if, that's something that's pretty common at Salt Lake County. But really with poorly controlled diabetes and, impaired vasculature down to the legs, that's, with peripheral vascular disease or arterial disease down into the legs, you get this change in blood flow, which leads to dry skin and poor healing to anything down there, as well as changes in neuropathy and sensation, which can lead to people stepping on things and having issues with developing wounds and ulceration and blisters down there because you lose what's called protective sensation. Protective sensation is kind of when if you step on something, so you step on a Lego or you step on a nail, you have the sensation to tell that you injured your foot and you can offload it so that it allows it to heal. When you have these really, really bad changes in sensation, you lose that protective sensation so that you step on something like a Lego, you don't really know that it's there and you put your full force on it, and that can cause injuries and wounds. You also get changes in temperature. You can kind of have variable sweating changes in your foot too. So managing that kind of sweating can be important at keeping your feet healthy. But you also lose that weakness that we've been trying to work towards strengthening as well. And when in really, really bad diabetic foot cases that I've seen, we can develop what's called a Charcot deformity, which is kind of this bottom right foot, where those muscles kind of fail, and then we lose lose our full arch, and we actually start getting these micro fractures in our bones, and then our whole arch collapses. So really just trying to take care of your feet and take care of your diabetes or vascular changes in your feet can be really helpful. What we can do if you do have diabetes or, poor vasculature down in your feet, I really recommend daily foot checks. That can be you doing those, that can be a spouse, that can be a friend, but really taking a look and looking for blisters, looking for redness, looking for any wounds, checking between your toes, looking for, extra nail growth that's kind of cutting in and causing, an ingrown toenail. All those are big things that you want to bring up with your podiatrist, as well as any of your vascular doctors too. Looking at proper footwear for diabetic foot care too. We want something that's leather, but also kind of breathable too. It depends on whether you're having a lot of sweating down there too. If it's leather, you're going to get a lot more sweating, so you have to kind of change your socks multiple times a day. Making sure your feet stay clean, so looking through those toes, cleaning them daily, even if you don't take a shower. Taking a look inside your shoes every single time before you put them on, making sure there's, nothing in there. I've worked with a couple patients back at the Cincinnati VA hospital that, didn't check their shoes regularly, and they had a granddaughter put a Lego in there. And they were walking around with a Lego in their shoe for 2 days, and they ended up with a foot wound. So those are really, really important to look at, as well as kind of regular exercise, and controlling your blood glucose. Those are the biggest things for prevention of the foot wounds. I think I saw a bunch of questions pop up, Sadie.
Yes, we have quite a few. Somebody asked, what's the best treatment for hammer toes?
Okay. Hammer toes are difficult. It depends on if they're flexible or if they're kind of fixed. Most often, and I've talked to a couple podiatrists about this, if it's not causing you issues pain-wise, and it's just more of an aesthetic issue, they don't touch them. If it's causing a lot of pain, usually they might have to go in and do surgery to correct it, because hammer toes and mallet toes are usually genetic in origin. So it's not something like a muscle imbalance or, poor intrinsic foot strength that's causing it. It's usually just genetic.
And the next question is from somebody who is talking about overpronation. So it says, my 5-year-old is showing signs of overpronation. Would you recommend him seeing a podiatrist, or is there a brand of shoe you would recommend for kids?
I haven't done a lot of research into kids' shoes. The 5 years old, there's going to be some different gait abnormalities sometimes. They actually could probably come and see a PT, and then we can work on ankle proprioception, doing things with the walking pattern to try and get more of a normal gait pattern as well. I don't think it's at the point where they need to see a podiatrist unless they're having, a lot of callus buildup or a lot of serious pain through their feet. Most often, if they're going through, regular development and doing a lot of activity outside and different variable amounts of activity, and not sticking to like one sport, right? Then they tend to grow out of it. But if it's kind of a consistent issue, then they can definitely come and see a PT for it.
Thank you. Our next question says, what effect do stilettos and shoes with high heels have on legs and feet?
They can have a great effect, but it all kind of depends on how often you're wearing them and how long you're wearing them for. There's not a lot of research that I found, like I was talking about before, of stilettos causing bunions. more genetic, but also if you think about it, you're putting your feet into a position for a prolonged period of time that's going to end up developing changes. So while we can't find a research connection between those two things, wearing high heels and wearing stilettos to bunions, in my mind, they're pretty close. Because you're putting your foot in a poor position for the toes to be mobile and to basically spread out. But also, you're putting your Achilles in a shortened position. You're putting your calf in an awkward position. So, these kind of Achilles tendonitis and plantar fascia pain can also be caused or contribute to, you wearing those shoes.
And this was more of a comment from a participant. They said that they have plantar fasciitis and it
Mm-hmm.
feels like their heel is broken. So they bought some copper compression arch supports.
Mm-hmm.
And it has helped them a lot. Is that something that you would recommend as well?
Yeah, that's awesome. I mean, I'm all for anything that helps reduce pain. What I will say is, the compression components of it, they don't provide a lot of support. The arch support in the shoes is going to actually give you a little bit more support when you're walking. But if the compression, the arch compression really helps reduce pain, then go for it for sure.
Awesome. And the next one is asking podiatrist or orthopedic, how do you choose?
So the podiatrist that I've worked with, it's really, if anything's related to your foot and ankle. They are generally surgeons as well, and they work with feet and doing, specific foot surgeries. Orthopedic docs are more like the general, you have a fracture, you have a need for a total knee replacement. Podiatrists really specialize in foot care and foot surgery. So they'd be your best option to go to for any sort of, injury regarding your foot or ankle.
And I guess that kind of leads into this next comment. We have someone share that they have sharp stabbing pains in the feet and legs. So would you recommend that they would see a podiatrist for that?
Yes and no. Depends on where they're getting that sharp and stabbing pain. It's actually not a bad idea. So as physical therapists, we are, able to be providers, and we can get referred or we can get self-referrals. So we can be kind of the first access point, and we can take a look and see whether we think that sharp pain is coming from muscles around your leg. Is that related to your heart? Is that related to your back? We can take a look and see where the best option would be to go forward. It's hard to say, with just sharp and stabbing pains in general, kind of all over the legs and feet, where it's really coming from.
Thank you. And I wasn't sure if you were going to ask or to talk about this, but do you know of any treatments for toe fungus?
Toe fungus. That would probably be more your primary care. Usually they can get you antifungal creams if it's not going away with any of the over-the-counter stuff. You can also go, dermatologists will also help with that too.
Thank you. It looks like we have a couple more. Is it normal for, I hope I'm pronouncing this correctly, sesamoid injuries to last for years and after use of orthotics?
Yeah, so the sesamoid bones, I'll go back to here. So you're talking about these bones right in here. The difficult part about fractures in these bones is because we're putting a lot of pressure through our foot, there's actually decreased blood supply in here. And when you are trying to heal something, you need blood coming to it to give all those good healing factors. So these bones right here, since we are putting a lot of pressure on there, there's less blood supply to them. And it can take a while for those sesamoid fractures to heal for sure. if they're still getting pain and they're still having, on imaging when you have another X-ray, if there's still fractures there, I think that just means that you probably need to immobilize it a little bit more. But that would be a conversation with your podiatrist for sure.
All right. And is barefoot walking good or bad for your feet?
That's a tough one. I know in recent years, there's been a lot of drive for kind of barefoot running and barefoot walking. It's good, but it's also bad. You need to gradually build up to it. So, like I was saying before, those drastic changes in shoes and in activity can cause issues in your feet. So if you're trying to get to more of a barefoot walking lifestyle or running, it's that gradual build up. Being in shoes actually makes our feet a little bit weaker. We're not working on those intrinsic muscles whenever we're walking because our shoes are doing it for us. So, we have all of the tools we need to be able to function barefoot. But through evolution, through us wearing shoes, our feet have adapted to not be as functional barefoot. It can be progressed, right? It's hard to say which one is better than the other. And if there's a goal of you wanting to try to do more barefoot walking, then I would do it gradually.
And the last question we have in the chat box is, my feet and arches hurt when I do the leg press at the gym. Do I just need different shoes, arch supports, etc.?
Yeah, leg press. Does it hurt with standing?
We'll have to have Sarah put that in the chat box if it hurts while you're standing. Yes, okay. After.
Yeah, I mean, that can be, similar to like a plantar fasciitis type pain. It could be those arches collapsing. What I would try to do is really work on those arch lifts. And while you're doing the leg press, see if you can maintain that, even if you go a little bit less lighter weight than you normally would do. See if that's just like an intrinsic muscle weakness causing it or something else.
We've had a couple of questions since that last one. We had a participant write, I've had several foot surgeries for various reasons. My foot now has a lot of internal built-up scar tissue. Is there anything I can do to reduce the thick internal scar tissue?
You can. You can start by kind of self-mobilizing your feet, stretching, strengthening as well. If it's multiple surgeries, that scar tissue is going to be really tough to kind of break down. I'd probably look at how much you're exercising and walking as well, because the more we can kind of load that foot, the better it's going to be able to move. Kind of hard to say without knowing the specifics of the surgeries and how long ago they were done too.
And do you know of any websites that show some foot anatomy that you could provide links to?
Sure. Yeah, I could send those over to Kim, and Kim can send them out to Sadie, I think.
Awesome.
And just so you know, Sadie, I do have maybe 3 more minutes because I do have a patient at 1 o'clock.
All righty.
All right, I got a couple more slides.
Okay, that's perfect. That's what I was going to ask. We'll have you keep going through the slides.
Cool. So really talking about prevention, if you're sitting most of the day, the best thing you can do is kind of get some regular exercise. That's starting on a walking program, and it sounds like, March is what you're starting. So that would be a great way to start building up your exercise tolerance. Looking at your posture and your desk setup as well to prevent low back pain, but also, your feet too. Looking at your good, comfortable footwear like we talked about. Those ankle and foot exercises like we did, or like I've been talking about. Arch lifts, toe curls, trying to go through them every couple hours, as well as kind of the calf stretching as well. And really try to go either for like a quick 2-3 minute walk every couple hours or stand up. You know, a lot of people are getting standing desks now, so it's good to kind of alternate between both of those to help provide a little bit of input to your feet and work on those muscles. If you're standing most of the day, really big important thing is find good footwear with good arch support. You know, changing out your shoes every day, trying to do two pairs and alternate so that we can keep that midsole in good shape. You know, shifting your weight whenever you're standing if you have to do a lot of like manual work. Not standing on one side for too long. Using a step stool and alternating your weight on the foot on the step and the foot off the step. Regular exercise as well as the stretches and exercises I showed you. And really when to see a provider too. You know, you can see a PT with common sprains, injuries, any sort of foot pain that's not going away. If your balance or if your walking becomes impaired and you feel like you're going to fall because of your foot and ankle pain. If you need to look at kind of the shoes and you want a more of an opinion from a PT. And if you want to start getting moving, really, if you want to start exercising in a safe way that reduces that foot pain, or you know, you want to manage that foot pain, we can come and see us. When to see a podiatrist, really, with any sort of diabetic foot care, vascular changes, you want them on your team. If you have a bunion that pain is not going away with PT or regular exercise, any sort of those fractures, change the sensation of the feet, and if physical therapy basically fails, if there's nothing that's helping. All right. And any other questions? Actually, sorry, no time for questions.
You can send them to me, Katie, and I'll get them to him.
Alrighty, sounds good. Thank you so much for being here with us today and answering all of our questions. It sounds
No
like this is a
problem.
very popular topic for our participants, so thank you.
Yeah. No problem. Happy to be here.
All right, well, everyone, you enjoy the rest of your day. If you didn't sign in, I will put the sign in link in the chat again. And enjoy the rest of your Wednesday.
Keep going away, that's funny. Oh, it's okay.
All good.